listening to the discussion aisle, and I'm your host Sohaib bin Noor, only on Plant FM 87.6. And dear audience, as always, we have a special guest, an eminent personality in our studios, and we are going to discuss a special topic and on your special channel, that is Plant FM 87.6. And today is World Anti-Tobacco Day, or World No Tobacco Day. That's been just marked and observed all around the world, and especially in Pakistan. And in Pakistan, alhamdulillah, we have a proper ban on smoking, and there are no advertisement that you can see on media or even the mainstream media, like in videos or in form of documentaries or any kind of vocal voices. And as compared to that, we have seen advertisement only on the packet, and with packet there's a warning sign that if you're going to smoke, or if you have some kind of addiction with the smoking, then you can have some unfortunate incidents in case of cancer, and you're going to be affected by this cancer menace. And this is how our Ministry of Health is working, and our Ministry of Health is just focusing that how we can reduce the number of smokers in Pakistan, and how new tax implementation could be just introduced so that the cigarettes get more and more expensive, and it could get out of the reach of a common man. And especially we have some policies that the people, the children who are underage or who are just teenage, they cannot be in a form to get cigarettes from the markets, and everyone has a special warning by the ministry and by the authorities. If he is going to sell the cigarettes or any kind of nicotine type of components to a specific person who is underage, then he will have to suffer the consequences. And today we have a special guest, Mr. Muhammad Aftab Ahmed. He is the project manager of Tobacco Control Cell that works under the Ministry of Health, and today we are going to talk to him. Assalamu alaikum, Dr.
Thank you very much for providing the opportunity on World No Tobacco Day. Thank you.
You're always welcome, sir, and indeed it's a big pleasure that you are here with us in our studios, and we're going to talk about tobacco. And Dr. as the world is marking No Tobacco Day or Anti-Tobacco Day, what is it all about?
Yes, actually World No Tobacco Day is being observed in Pakistan as elsewhere in the world on 31st May 2024 to highlight the hazards associated with the use of tobacco and spotlight efforts being made by government, civil society, individuals across the globe to safeguard the health of the people through prevention, persuasive and measures against the use of tobacco. And the theme of current year is protecting children for tobacco industry interference. And basic purposes of this theme is to advocate for an end to the targeting of the youth with harmful tobacco product. And this discourse provides a platform for young people, policymakers and tobacco control advocates globally to discuss the issue and to urge government to adopt policy that shield young people from the manipulative practice of the tobacco and related industries. Although cigarette smoking has decreased over the years due to phenomenal efforts by the tobacco control community, most by done to safeguard this vulnerable group in Pakistan. All over the world, 8 million people kills due to smoking means all types of tobacco, naswat, pan, gutka, cigarette, shisha, e-cigarette, and 1.2 million people dies due to second-hand tobacco smoke all over the world. And more than 80% of people of 1.2 millions belongs to low middle income countries like Pakistan, and there's a huge number of deaths of second-hand smoke and directly smoking of tobacco.
And doctor, what's the difference between first-hand smoker and the second-hand smokers?
Yes, second-hand smoking generally known as passive smoking.
Okay.
And directly smoking is a smoking of any type of tobacco product. Whereas second-hand tobacco smoke is a smoke any non-smokers inhale the air or any other public place and public vehicles where smoking is usually happened at any public place. And any user or customer, clients, if we visit that public place where smoking is happening casually, then anybody, if he spent 2 hours at any public place, he can smoke 2 cigarettes in 2 years, 2 hours.
In 2 hours.
And if a person spent the 1 day with their relative and friend, and that friend will use 1 cigarette packet, and this friend can be equivalent to 3 cigarettes. This is a second-hand smoke.
Okay, although he's not smoking, but due to inhalation of that air where the smoke is present, then it means that he's also smoking in a form of second-hand. And it's much alarming that 1.2 million people in the world, they are dying just because of second-hand smokers, although they are not smoking.
Yes.
Okay.
And if in Pakistan perspective, 70% our workplaces are fully indulged with smoke, with second-hand smoke. Even our household are fully packed. 48% are second-hand smoke.
So
this is very alarming.
Exactly, much alarming.
Directly smoking is also very alarming for Pakistan, whereas second-hand smoke also very dangerous for our non-smoker citizens.
Exactly, you are much right. And Dr. Aftab, as the world is marking No Tobacco Day today, what's the message, what's the theme, and even what's the mission of this day, and why do we mark these days?
Actually, whole world is desired to declare their upcoming generation tobacco free, and we have a desire, and Pakistan government and our ministry has also working for children, and actually 1200 children in Pakistan between the age of 6 and 15 start smoking every day, which is a huge number of children. And actually if we have a target to rid from the tobacco menace, then we have to work on the children.
Exactly.
And we prohibition of tobacco product and sale and use of tobacco product is also imposed on and promulgated the ordinance of prohibition of smoking, protection of non-smokers, ordinance 2002. But some children we can observe in anywhere they are indulging in smoking. But our government, our administrations, our policymakers and civil society should work on children, and if we want to declare Pakistan smoke-free country, then we have to work on children.
You are much right. And Doctor, the rules and laws are there that even your ministry is working, that no seller or retailer is, he can or sell, cigarettes to any teenager or the kid who is under the age of 18. Then how we can see that the ratio of smoking is increasing day by day, especially in the underage children?
Yes, actually we have a data of 2014 of WHO. Pakistan has a burden of 23.9 million smokers in Pakistan, where 13.1% are youth under 18, and Pakistan has a very serious consequence about youth which is being indulged in tobacco, and especially we are facing the challenges and problems about nicotine, new tobacco product and novel tobacco product, and our youth is very feeling the attraction from novel tobacco product.
Exactly, you're right. And if a retailer or a seller, he is just being involved or caught on the spot while selling cigarettes to an underage child, what would be the action?
What would be? Actually, our ordinance prohibition of smoking, protection of non-smokers as ordinance 2002 prohibits the sale of any tobacco product to minors. Our section 8 prohibits the sale of tobacco product. If any retailer sell the cigarette or any tobacco product, then magistrate or assistant sub-inspector impose the case against and fine up to 1,000, and in subsequent offence 1,000 to 1 lakh, 100,000 fine can be imposed. And 3 months imprisonment can be imposed on violators.
Okay, the violators will have to face almost 1,000 to 1 lakh rupees of fine and imprisonment up to 3 months. So these are the things that the ministry and even the authorities have just implemented. Dr. Saab, the number of smokers in Pakistan, what's the statistics, what are the statistics and what is the data that you have collected? And kindly tell us about how much the minors they are involved in this menace of smoking.
Yes. Actually, Pakistan has a 23.9 million smokers according to 2014 Global Health Tobacco Survey, and 1,63,700 Pakistani kills every year, which become 448 daily. And our youth is 13.1% of 23.9 million smoker is indulgent smoke.
They are indulgent
Yes.
smoking. Exactly, you are much right. And how do you think that how we can control the ratio of smokers?
Yes, actually, firstly we should implement our laws with letter and spirit. I want to describe the whole ordinance in 5 sections. Section
Sure.
5 of Prohibition of Smoking, Protection of Non-Smokers, Health Ordinance 2002 prohibits the smoking at public places and public vehicles, and Section 6 prohibits all tobacco product at public vehicles. Section 7 prohibits all tobacco advertisement at point of sale, and Section 8 prohibits the sale of tobacco to minor, and Section 9 prohibits the sale of tobacco product near 50-meter radius of the education institutions, and Section 10 is authorized to all public place manager to declare the public place smoke free along with no smoking signs. And at prominent places with this public place is a smoke free facility. And Section 5, 6 and 10 is a non-cognizable, and it can be implemented through summary trial or kalandra. And Section 7, 8 and 9, advertisement, sale to minor and shops near to schools is cognizable sections, and sub-inspector can arrest the violator and send the case to magistrate for further proceedings, and magistrate can impose the fine on one or couple of hearings with imposition of 100 to 1,00,000 fine on violators. And if we control the rates number of youth in indulging the tobacco smoking, we should work on our school going children and under 18 youth. And Islamabad ICT Administration, Chief Commissioner Islamabad, Federal Directorate of Education and Ministry of Health is signed a MOU for creating a smoke-free generation in Islamabad. And in first step, we have we will register 50 major schools from private-public partnership, and 1 teacher and 2 volunteers per school will register, and then we will train and educate for further cascade trainings and follow-up awareness campaigns on quarterly basis in school and colleges. Then we further register volunteers, and we have a target of 1,000 registered and trained volunteers at the end of this fiscal year 2025.
That is good to know that the ministry is working and they have a proposal that they are going to work with the education institutions, and you will have some ambassadors in your own education system, whether they are from public sector, from the private sector, and they will be a volunteer force from the government. That's a good step and very welcoming indeed. Just want to know, what about the rest? I mean, you are talking about the capital, Islamabad. What about the provincial basis authorities and especially the provincial health ministries? How they are working in collaboration with your ministry?
Yeah. Actually, we have a WHO strategy, Empower. Empower has 6 words, MPOWER, but 6 strategies. A package of 6 strategies. M means monitoring, P prevention measures, O offer help to quit tobacco, E enforcement, enforce tobacco advertising, promotion, sponsorship, or raise taxes on tobacco. Last strategy or raised taxes on tobacco is a most effective strategy which is tested in globe. And Pakistan has imposed the 200% federal excise duty on cigarette packets in this fiscal year to 2023 and 24.
Good.
And we have a planned 30% more, and the Ministry has sent our proposal to Ministry of Commerce to further 30% imposition of the tobacco taxation on tobacco product. This is a major strategy and policy to control the tobacco menace in Pakistan. As we are concerned to provincial authorities and governments, and we have already developed the health subject to the provincial, and KP, Punjab and Sindh, 3 provinces have their own tobacco control cell, and they have adopted our policies and strategies which was initiated by last year. Minister of Health devised the first national tobacco control strategy 2022 to 2030. Which all provinces has adopted our provincial tobacco control strategy, and today KP announced the first province KP which has announced today this tobacco control strategy with latent spirit on grassroots level, so that tobacco consumption may be declined in KP and other provinces. And Punjab has a NCT department, non-communicable disease, and Punjab has implemented the smoke-free city project in 27 districts out of 37 districts.
Right.
And their deputy commissioner is a chairman of district implementation monitoring committee, and committee comprising the all major stakeholders including police, food authorities, railway, excise, education, chamber of commerce, and other major stakeholders. They meet quarterly and devise the policy, and there are also task forces are constituted comprising law enforcement agencies, and Punjab has implemented very vigorously, and a lot of fines, especially Punjab Food Authority has implemented the tobacco control laws at hotel and restaurant and retailers.
Okay, that's good. And Dr. Aftab, just want to know that as we see provincially, we have a diverse, I must say, kind of usage of different things. Like in KP, if we move towards KP, we see the usage of Naswal. Then in Punjab, we see more cigarettes. If we move towards Sindh, we see more and more gutka. So, what are the different strategies and policies that have been adopted by the provincial authorities?
Provincial KP province imposed the tax on Naswar last day, yesterday, and Sindh Provincial Assembly banned the tobacco, banned the gutka manufacturing, selling in 2020, and Balochistan also banned the shisha and gutka in Balochistan province.
Okay, and what are the strategies for if now as the technology is evolving, we are also seeing and transition in the addiction of different things, like now vape has been introduced, shisha and electric cigarettes have been introduced. So do you have the same strategy, same implementation on these products either?
Actually, vapes, electronic cigarette and other is not cover our law, and we are have a proposal with Ministry and of our Ministry and Ministry of Commerce and DRAB for scientific research on value and vapes, and so that we can incorporate in our law and implement the tobacco control laws on novel tobacco product.
Okay, you are much right. And other tobacco products, I don't want to name that, but a small pouch, you can have enough very attractive and appealing box, and you can just go to any shop, you can buy that. What about that?
What about? Yes, this is also a challenge. New tobacco product
exactly containing nicotine.
Yes, contain nicotine, but this is unfortunate, very unfortunate. This nicotine pack should be available at medical store, not a retailer.
Exactly.
Yes, and if anybody could want to quit tobacco, and they can purchase nicotine pouch on the prescription of the doctor, medical doctor, and after treatment they can use. But our children are using the nicotine pouches, and this is very unfortunate. And we have proceed and send the summary to DRAB for scientific and laboratory test.
Okay, you are much right. And of course, as you have just talked about that, how there are many policies that have been introduced by the ministry and your authorities as well. Just want to know that how you are going to ensure that such products could not be sold to the minors, and especially the people who are not aware, or they just want a thing that is much appealing, that is much styling, or that is much increasing the trending things that can make their style. So how do you can just impose that, restrict that?
Yes, actually we classify the diseases in two types: communicable and non-communicable disease. Tobacco lies under non-communicable disease, but our expert and public expert lies tobacco in a communicated disease, not a communicable disease, but communicated. One person starts smoking after seeing, after observing you.
Exactly.
And this is a phenomenon of marketing of the tobacco industry, and other manufacturers adopt these marketing strategy and advertisement strategy, so that our youth want to cool. After using the new novel tobacco product, and they feel like a hero, and something others, and beyond the heroship after using the new tobacco product.
Exactly, and they have many bad consequences. And Dr. What are the main consequences that you have just come up with if you are using smoking, or you are using novel products, or even you are using vape and other things? What are the consequences on our health?
So there are serious consequences.
Likewise.
And likewise, smoking effect on our voice box and our lungs and our oral cancer, causes oral cancer, heart disease, stroke, and blindness, and they are all effects on the harmful effect due to tobacco.
Due to tobacco. And what about Naswar and Gutka?
Yes, all oral cancers. In National Medical College Multan, Aga Khan, Shaukat Khanam, and all atomic energy cancer hospitals, you may see all oral cancers due to Gutka, Pan, Naswar.
Gutka, Pan, and Naswar, they are very injurious to our health. And Dr. Saab, as the theme is about protecting children from tobacco industry interference, how we can protect our children?
Yes, this theme announced by World Health Organization, and every year WHO announces the theme, and protecting the children from tobacco industry interference emphasize on governments and policymakers and civil society to do something for children. And we should emphasize and concentrate our upcoming generation. And if we are able to save our children now, today, we can imagine, we can estimate that our nation may be smoke-free after 10 or 15 days. Now Australia is a smoke-free, achieved the smoke-free generation target. They decided in 2000 and onward, they developed the smoke-free generation in Australia, and they achieved the target in 2018. Russia has a target of 2035, and Pakistan also planned in this regard to announce the 2040. I think a targeted year will be announced very soon.
Inshallah, target year will be announced very soon to your audience, as we were just talking about on the non-anti-tobacco day and World No Tobacco Day that has been just observed today. And Dr. Mohammed Aftab, the project manager of tobacco control cell that works under the Ministry of Health, we were just talking about that how we can control tobacco and use of smoking here in Pakistan, and how we can reduce that number. Unfortunately, it is increasing day by day, but we are much successful in the imposition of more taxes, and we have raised some taxes on the tobacco products. And right now the companies have their interference, and they are introducing new catchy products, so that the young lot may get appealed and get attracted towards them, like the novel products or even the anti-smoking pouch. So these things have been introduced, and there might be a new strategy or new law and enforcement will be required to overcome this whole situation, so that our next generation could be get out of these manners of smoking or the usage of nicotine products or other products that are more injurious to our health. And even some people, they always say that no, it doesn't affect ourselves, but it reduces tension, or it helps our metabolism, or it helps in the digestion of food. Doctor, do you have any study that just proved that the smoking reduce tension, or it reduced depression, or it helps you in digestion of your food, or it helps you in making yourself more cool and more relaxed? What do you say?
Actually, these are all myths, not a reality.
Okay.
If a layman unload the truck or loading the truck,
Exactly.
you may see he may be smoking right or left side of the truck.
Exactly.
Maybe he's feeling that smoking is an energy drink,
Exactly.
but smoking shrink our veins and rise the blood pressure, and we are feeling in a mood, and swings the mood, and we feel that something is better about smoking. Lekin these are all myths, but there is no reality to for our health or for a constipation or other myths, but there is no reality.
There's no reality, just
Yes.
for your state of mind that you're relaxing, or you
Yes.
have some lame excuses in your own mind that it's going to relax me, or it will help me to digest my food. And Dr. As the project manager of Tobacco Control Cell, what are the projects that you have successfully implemented so far?
We have I will share the statistics of Islamabad and Karachi.
Sure.
In Islamabad, in previous 2 years, Pakistan has Islamabad administration has more than 4 million fines on violators, and 20 million illicit tobacco is confiscated in Islamabad, including shisha and illicit smuggled tobacco. Whereas in Karachi, 148 million illicit tobacco confiscated, and 40 million fine imposed on violators. And this is a success of our project. Their implementation, law enforcement agencies is being implemented the tobacco control as well as spit in public places, in public vehicles. In Islamabad, in urban area, if you visit a public vehicle, I think there will be no one passenger can be seen with smoking.
You're right. It's much strictly implemented in the public buses.
Yes.
You are much right. And also, what are the future products that you're going to introduce soon?
Our future project is basic work on a smoke-free, to create a smoke-free generation in Pakistan. First model will be exercised and will be practiced in Islamabad.
Inshallah.
And inshallah, if we will succeed, then it will be replicated in all other provinces and districts and regions of Pakistan.
You are much right. And what about the smoking or tobacco industries? Are you imposing more and more taxes, or are you gonna, just ask them to shut their business?
This is the only way to control the tobacco manufacturers. This is enhance the tobacco taxation. Pakistan has a 200 tax enhanced in last year. Now 30% is also in a queue, and we have placed the proposals and will place the proposal in future in this year to Prime Minister and other Minister of Commerce and FPR to enhance the more federal excise duty on tobacco manufacturers.
Okay. And how many companies that are manufacturing tobacco here in Pakistan?
20.
21. Okay. And is there any proposal that government is going to restrict their businesses or impose more and more taxes, or even want them to just leave this business or introduce a new one?
Yes, yes. I will announce a major tobacco industry announces some 2 months before they are going to close their business in Pakistan by 2030.
By
This is a
2030.
good news.
Oh, good. It's a good news that these companies are going to shut their businesses. And Dr. Aftab, last but not the least, what is your message to our audience and our viewers that are viewing us on social media?
My message is please don't smoke at public places and public vehicles. Please keep the smoking outside the public places and away your children from your smoking and from tobacco product.
Thanks so very much, Dr. Aftab, for being with us and sharing
Sir,
your
thank you.
views
Thank you.
on this important topic. And indeed, dear audience, why do we mark these days? Because we want to just create awareness among the masses that are unaware of these products, like the World Anti-Tobacco Day or No Tobacco Day that has been observed today. And the only purpose is to create awareness that this thing is very, very much dangerous, and it will have some very bad health hazards on your physique and on your health issues that you're going to face in the future. And as rightly mentioned by Dr. Aftab Ahmed, he just said that all the hospitals, all the cancer hospitals, they are filled with those people who just had some excuses in their day back that smoking will not do anything, naswar will not do anything to us, or even pan or gudka will not affect our vocal boxes or our or it cannot keep ourselves indulged in cancer or any kind of injurious health hazards or diseases. So these are the things that have been just mentioned by Dr. Aftab Ahmed very precisely and very comprehensively. And if we want a generation that is much more healthier, that is much energetic, then we need to get rid of this smoking. And it is much bolstering that the government is imposing more and more taxes on naswar, gudka and cigarettes. But there should be our responsibility that what parents are doing, how they are guiding. The teachers have their responsibility that they need to have some awareness session in their classes so that the youngsters, they could not get themselves involved in this smoking. With this, dear audience, we are just signing off. Allah Hafiz, Fi Amanillah, and stay blessed. Take care of yourself.